When I first started to have problems, I was about 48 then. It seemed I had to go to the bathroom more and more often.
I would be playing tennis and I would rush up to the net and I'd have a little leakage. It would also happen sometimes when I'd cough or just laugh.
The last few years before I retired, I started getting these sudden urges to go to the bathroom. It got so bad, I even started wearing pads, just in case I couldn't get to the bathroom in time.
Bladder control problems, such as urinary leakage, are common. But everyone should know that they are not a normal part of aging and should not be accepted as such. In most cases, these problems can be relieved or even cured. Urinary incontinence is a medical condition in which a person does not always have the ability to control urinary leakage. Some women may feel a sudden urge to go that is so strong they are unable to control it. Or accidental leakage may happen with certain movements or other actions that put stress on the bladder.
Urinary incontinence affects approximately 13 million Americans, 85% of whom are women. Between 10 and 35% of adult women have urinary incontinence.
Unfortunately, less than half these women seek medical care.
At first I thought it was just a normal part of aging. I was approaching menopause, and I thought I was just going to have to live with it.
For a while, I was embarrassed to tell anyone.
I felt uncomfortable talking about it and tried to handle it myself.
And then I told my doctor and got the medical care I needed.
You should tell your doctor if you have any urinary problems, including any leakage, increased frequency of urination, or an increased urge to go to the bathroom. It's understandable that you may feel uncomfortable talking about it, but it's important to work with your doctor, because proper diagnosis and treatment may correct your problem and ease your symptoms. So that you can better understand what may be happening with your bladder, let's take a look at the genitourinary system, which produces urine and enables you to control it.
Every time you eat and drink, your body absorbs liquids. The kidneys filter out waste products and dispose of them through the urine. The urine is temporarily stored in the bladder. Your bladder is like a balloon, with walls made up of muscle. The urethra is like the neck of the balloon. It contracts and helps hold the urine inside the bladder. Normally, when the bladder is full, the nerves in the bladder tell your brain that it's time to go to the bathroom. Once you reach the toilet, your brain sends the message to the urethra to relax. Your brain also tells the bladder to contract. The bladder then empties urine through the urethra. The bladder keeps contracting until it is empty. Then the urethra contracts, the bladder relaxes, and the urine stops flowing.
When the system works normally, there is no leakage, and you will pass urine only when you want to. But if something goes wrong in any of these areas, you may develop problems with bladder control. There are several things that can go wrong with your ability to control your bladder.
There can be a loss of nerve control over the bladder muscle. This can occur because of medication you are taking, or it may be related to a medical problem. Your problem could be due to an infection within the bladder. Symptoms include increased frequency of urinating, where you go more than 7 times per day, strong sudden urges to go to the bathroom, waking up to urinate 2 or more times a night, or involuntary loss of urine, whether small or large.
It would come on suddenly, and sometimes I couldn't get to the bathroom in time and I would have an accident.
Your doctor may call this type of bladder control problem urge incontinence, because you feel a strong urge to urinate and you may lose urine before you get to the toilet.
The amount of urine would vary. sometimes, even though the urge was strong, there really was very little urine.
Another major type of bladder control problem is called stress incontinence.
Stress incontinence is leakage that happens during a cough or sneeze, when you try to lift a heavy object, or when you exercise. These activities momentarily increase pressure in the abdomen and in the bladder, resulting in urine leakage.
Stress incontinence may be due to weakened pelvic floor muscles that allow the pelvic organs to move out of place, or a weakened urethra may be unable to keep the urine inside the bladder.
Weakened pelvic support may be caused by childbirth, when the pelvic floor muscles become stretched. Aging may also be a factor. After menopause, your body produces less of the female hormone estrogen, which helps keep these tissues strong.
It's fairly common to have both the symptoms of stress incontinence and urge incontinence. This is called mixed incontinence. Also be aware that there are other factors associated with bladder control problems. For example, excessive fluid intake is associated with increased frequency of urination. Some women may realize they are going to the bathroom more often than they think normal, but they may not associate it with the fact that they take in large quantities of liquids. Constant sipping of water makes it especially difficult to track intake of liquids. In addition, excessive caffeine or alcohol intake may also play a role in urinary incontinence. Almost everyone with a bladder control problem can be helped. First, you need to realize you may have a problem. Then you need to seek the help of a doctor. The earlier your problem is diagnosed, the sooner you can be treated. Because bladder control is affected by multiple factors, it is important that your doctor be aware of your symptoms and when they occur. One good way to help you communicate with your doctor is by keeping a voiding diary.
I simply wrote down all the times I went to the bathroom, both day and night, and whether I had a sudden strong urge to go or not.
The diary will give the doctor a good idea of how to begin looking for the right treatment for you.
Also be prepared to answer your doctor's questions about medical history, medications, and other factors that may affect your bladder control. It's important for the doctor to find the cause of your problem. Sometimes the condition is suggested by your symptoms and medical history. In other cases, a woman may be given a number of tests. These tests can include a pelvic examination, lab tests for infections, a stress test in which you are asked to cough with a full bladder, and other medical tests. These can help your doctor find the proper treatment for you.
The doctor determined that I had urge incontinence. She prescribed something that really worked for me, a combination of medication and behavioral treatment. The medication helped to relax my bladder muscle and control involuntary contractions that were causing the strong urges. The doctor started me on behavioral treatment to retrain my bladder. In my case, it involved a regular schedule for going to the bathroom, and she taught me how to avoid going in between times. It wasn't long before the problem got a lot better.
There are new medications that can help calm your bladder and reduce urges. If you have a urinary tract infection, you may be given an antibiotic. And estrogen replacement can help some women after menopause by increasing the thickness of the supportive tissue of the bladder and urethra.
The doctor determined that I had stress incontinence because I would sometimes leak when I coughed or laughed or played sports. She taught me Kegel exercises to help me strengthen my pelvic muscles. She showed me how to make sure I was using the right muscles when I exercised. I squeezed my pelvic muscles, being careful not to also squeeze my abdominal muscles or my buttocks or thighs. I hold it for 10 seconds. I do this 10 to 20 times in a row, 2 or 3 times a day.
If you have weakened pelvic muscles, doing Kegel exercises correctly for as little as 6 weeks can bring a big improvement.
The doctor found out that I have mixed incontinence, which is leakage during stress and a strong urge to go to the bathroom. She worked to find a combination of treatments that would work, and we found a medication that helped control my urgency. And the doctor taught me how to do Kegel exercises for my stress incontinence.
There are other treatments too. A pessary is a device inserted into the vagina that may be used to support the pelvic organs and also prevent leakage by pressing against the urethra. Weighted cones can be placed in the vagina twice a day to assist in performing Kegel exercises. For women not helped by other treatments, electrical stimulation can be used to make pelvic muscles contract. And if your problem cannot be improved using these methods, your doctor may recommend surgery.
In addition to seeing a doctor and getting treatment, you can also make simple lifestyle changes to relieve stress on your bladder. Stop smoking. Cut down on drinking alcohol. Avoid excessive caffeine intake. Control your weight. And avoid heavy lifting.
In most cases, your bladder control problems can be treated successfully. It may require a little effort, but better bladder control will enable you to live a more active life without fear of accidents and without the inconvenience of always staying close to a bathroom. You and your doctor can work together to make things a lot better.